Picture a healthy 50-year-old dealing with a stubborn case of frozen shoulder. Even after months of professional massages and physical therapy, the stiffness in the joint remains completely unchanged. Then there is the person whose handwriting begins to shrink, the letters getting smaller and tighter with every sentence. Or a spouse who seems to stop smiling, their face gradually settling into a rigid, expressionless mask. We usually brush these things off. We blame a stressful job, a bad mattress, or the simple friction of getting older. These symptoms point directly past the joints and into the brain. They represent the earliest, invisible neurological warnings of Parkinson's disease. Because we often misinterpret what this condition looks like in its infancy, many patients lose the critical window for early medical intervention. The public image of Parkinson's usually involves a dynamic tremor, a hand shaking while reaching for a glass of water. In reality, that specific type of shaking rarely points to this disease. The medical hallmark is a static tremor. This subtle motion, like rolling a pill, occurs specifically when the body is at rest. Other kinetic warnings are even easier to miss: a foot that drags slightly along the pavement, a single arm that stops swinging during a walk, or a voice that suddenly drops to a hoarse whisper. And it isn't just an old person's disease. With 25 known genetic links, onset frequently occurs in a patient's 50s, or even their 30s. To understand how these disconnected symptoms create such a systemic cascade, we have to look at the chemical failure happening deep inside the brain. Inside the substantia nigra, clusters of a protein called alpha-synuclein begin to build up. This accumulation eventually kills the cells responsible for regulating movement. This cellular death creates a severe shortage of dopamine. Without this crucial neurotransmitter, the brain loses its ability to send fast, clear signals to the body's limbs. But dopamine does more than just move muscles. This deficit impacts the entire nervous system, often triggering non-motor issues like constipation, anxiety, and depression, a full decade before the physical shaking ever begins. Doctors use advanced neuroimaging, like these MRI scans, to identify structural changes and confirm a diagnosis. They combine these visuals with blood tests and detailed clinical observations to catch the chemical theft early. Ultimately, Parkinson's is a holistic, systemic shortage of the brain's primary communication fuel. We have to acknowledge the reality. This disease is progressive, and currently it cannot be reversed. However, it is a chronic condition that can be managed over several decades, much like diabetes or hypertension. Modern medicine follows the Lucky 7 blueprint. This timeline unlocks a 7-year honeymoon phase, a 14-year working phase, and a retirement phase of 7 years or more, all while maintaining a high quality of life. The primary tool for this is levodopa, a dopamine replacement therapy. Its effectiveness depends entirely on one golden rule: the medication must be taken strictly on time, every single day. For later stages, doctors can use deep brain stimulation. This involves a pacemaker-like chip implanted in the brain to provide electrical stimulation, which reduces the patient's need for heavy medication. These advancements have turned what was once an uncontrollable fear into a highly engineered, multi-decade management plan. Pills alone cannot maintain this 21-year timeline. Physical movement is required to physically amplify how well the drugs work within the system. Specific exercises like Tai Chi are highly effective. The rotational footwork trained here helps prevent the dangerous shuffling gait that often leads to injuries. Brazilian tango provides a similar benefit for balance and coordination, while yoga helps correct the hunched posture that many patients eventually develop. Diet also plays a mechanical role. Because the disease slows down the gut, a high-fiber diet is a mandatory requirement for every patient. There is also a vital chemical conflict to manage. Protein can actually block the absorption of levodopa. Patients must wait at least 1 to 2 hours after taking their medication before consuming dairy, soy, or meat. Success depends on the patient becoming a master of their own metabolism and kinetic movement. Despite the neurological complexity of the disease, the single biggest physical threat to a patient's life is actually quite mundane. It's falling down. These patients often suffer from osteoporosis, meaning a simple indoor fall can result in a fractured femur. This kind of injury can instantly destroy a decades-long survival timeline. Defense begins at home. Removing loose rugs, adding grab bars, and keeping floors bone dry are the most important steps a family can take. A diagnosis brings significant fear and anxiety, and the emotional weight of that shouldn't be ignored. With the right combination of early detection, metabolic discipline, and movement-based therapy, a Parkinson's diagnosis marks the start of a decades-long, successfully engineered life.